Hello, I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Thank you again as we do our weekly town hall meeting. We appreciate the opportunity to be able to update you on what's going on with our COVID response plan, and more importantly, to answer all your concerns that you have. I'm joined today by the Commanding General of the Joint Task Force Headquarters, National Capital Region, and the MDWCG, Major General Jones, for this week's special guest, and he's also my boss. And also joining, as always, Captain Judy, the Director of the Fort Belvoir Community Hospital, is also joining us today. And so now I'll turn it over to Major General Jones.
Well, Team Belvoir, it's really good to be here. I would much prefer that if we were in an auditorium across the street and we were able to see each other in person and have a dialogue. I enjoy those town halls when we've had them over the past year, but this is a close second. If we can't be here in person, I am glad to be here in the Belvoir Garrison headquarters today. I am glad to see the team that is here with us, 6 feet apart, and I'm looking forward to your questions. But before I get started, I just wanted to say a couple thank yous. First, wanted to thank Michael Greenberg and the entire Garrison team here. I think that the leadership that the Garrison team has demonstrated, throughout this pandemic, throughout this crisis, has just been incredible, and just really done a great job to address concerns across the community, protect the community, make sure essential services are still working, and to keep us informed. And Michael, I thank you for that, and I thank your entire team for that. I'm a true believer that in times of crisis, transparent communication, keeping people informed, letting them know what's going on, and letting them know what we don't know is absolutely incredibly important. And I think in many ways, it doesn't solve the problem, but it can reduce anxiety a little bit. And I think this team here, through these weekly town halls, through the Eagle and through other means, social media, et cetera, has just done a great job. And I appreciate the whole team being involved in that. I'd also like to thank Cindy Judy and the team at the hospital. As you look across our country, our medical first responders have been instrumental, critical, essential to how we responded to this crisis. And for the Fort Belvoir team and community, it's been you and your team. And I thank you for that. I thank you for the quick response, to the professional care to make sure that we can take care of all our beneficiaries and keeping us informed going forward. But it's just, this community, the National Capital Region, and our country would be in a very different place right now if it was not for our medical providers. And I thank you and all of them for what they've done. And then really my last comment to all of you out there, thank you. We're probably 70 plus days now of staying at home, social distancing, face coverings. Very different than what any of us have probably experienced before. But I will tell you, you have made a difference, and I absolutely promise you that if you look at where our hospitals were and where they are today in terms of people, number of people that are coming through the hospital, our ability to treat patients, our capacity that's available, et cetera, we were able to take care of those folks that do have the virus and are sick because of your actions. And I thank you for that. And please know that you have made a difference. In this community here, there are so many organizations on Belvoir that are vital to our national security. And the ability that you all have had as a community to keep those organizations working, even though it's been distributed, even though it has been through telework, et cetera, but still to do everything the Fort Belvoir team does for our national security has been absolutely incredible. So my last two comments before I turn it over to Captain Judy is, and we'll talk a little bit about this over the next few minutes, but the virus is still out there. It is still in our environment. Clearly we're going to continue to adjust our posture going forward, but the virus is going to be with us for a while. So please continue to take care of yourself, take care of your families, take care of the people that are around you. We're going to have to operate in a COVID-19 environment, and that is personally, professionally, for a while. And I ask you to continue to take care of yourself while we're operating in that environment and take care of those that are close to you. And then finally, please send your questions in tonight. I'm looking forward to dialogue and very much looking forward to hearing from you. Thank you.
Okay, I'll turn it over to Captain Judy.
All right, thanks so much. Hey, good evening to both of you. It's a pleasure. This is one of my favorite times of the week to do this. it's a great forum to communicate with the community. And as you know, I like to start off with a thank you each week. And for the first time in a long time, over the weekend, I had the opportunity to go to the Commissary. I'm fortunate that I have a family member who shops most of the time these days, but I personally got to go. And you know, we've answered a lot of questions over the past few weeks about operations at the Commissary, and they seem to have taken a lot of criticism. And I just want to say that my experience there was phenomenal. So thanks to all the Commissary workers. You know, I appreciated how they clean in between every single patron as they're checking out, how professional they were, how courteous they were, and they're just extremely helpful. And I don't know if you know how much you're appreciated, and so thank you for that. I know everybody is very interested in the reopening plan, the recovery plan. It is the #1 topic, especially as each of the states in the National Capital Region come up with what their plans are. And as you know, we're in Virginia, and Virginia has divided into Northern Virginia and the rest of Virginia. Some of the things that we at the hospital are tracking really closely, sir, obviously are those gating criteria that come from the recovery plan. And so we're really watching for those symptoms, right, to go down. We need to see a trajectory of 14 days of a downward trend, and we're just not there yet. We haven't had a 14-day decline yet with any of that. We're also tracking the cases, and so 1, we're tracking the cases at Fort Belvoir Community Hospital, 2, we're tracking the cases in the National Capital Region, and 3, we're tracking the cases in Fairfax County and the counties surrounding us so that we can make a determination and help advise the installation and you, sir, on where we stand. I know you're getting that information from each of the installations that you oversee. And so we got a little hopeful, right? The confirmed cases per week trajectory was going up, and then all of a sudden it kind of leveled off. But we have not yet seen that decline for 2 weeks that we're looking for in order to really go to the next HPCon. Same with the state of Virginia. 2 weeks ago, we started to see a slight decline in the average number of new cases per day, and then we got a little jump up again. And so we continue to monitor that, and we'll continue to advise. The final criteria that they're looking for, obviously, is how is the hospital doing, right? What are the medical facilities' capability? And there's really a number of things that we're looking at for that. 1, what is our ability to care for the patients who have COVID and other serious illnesses that need that care right away? And we have that capability and that capacity. 2, how much PPE do we have in order to take care of all of those patients and an increasing number of patients as we start to open up more and more? And the good news is we have plenty of PPE as well. And so we're staffed adequately and we're resourced adequately to get all of that PPE that we need at this time, okay? And the piece that we're really working on right now is the testing. And as you know, we have plenty of testing for patients and people who are presenting, whether it's the emergency department or to an appointment or to the COVID clinic at the hospital. We have plenty of testing capability for that. And what we've increased over the past few weeks has been that mission testing, right? So looking at the different tiered testing for certain criteria for certain missions, we've increased that amount of testing quite a bit. But we don't have the capability yet to do that widespread population testing of just allowing everybody to come in, whether they're concerned about having COVID because they've been exposed or have some symptoms, but rather just as a screening, do I have it? And so we're getting there, but we're not quite there yet. So I'll let you know when we get there. I want people to know, and we talk about this every single week, that as we continue to open up services in the hospital, elective surgery, increasing those appointments, that it's safe to come in the hospital. In fact, we encourage people to come into the hospital. It's probably one of the safest environments you could be in right now, in all honesty. If you've been there recently, right, and you see the waiting areas, there's chairs that are either marked off or we've removed chairs from the waiting areas and so on. There's a lot of measures we've put in place to keep people safe. We'll start with the restricted access points with staff, patients, and visitor screening, right? So right now we continue to have 1 garage closed. That's where our drive-up or curbside pharmacy is located. But there's still plenty of parking in the front of hospitals, so patients can either be dropped off in the pavilion at Oaks Pavilion in the main entrance, and they can park in front of the hospital. And that's the main entrance for patients and visitors. Face coverings continue to be required by staff and patients, and obviously if personal protective equipment is required clinically, then that's what the staff is using and not a cloth face covering. We have a very restrictive visitor policy that remains in place, which we will reevaluate when it's appropriate. And we are restricting outside access to the dining facility by non-patients right now at this time. And I know that's kind of unpopular for the installation. We'll open that up when it's safe to do so. But we just really want to limit the number of people that are in the building right now. There's still that increase in virtual, telephone, and telehealth appointments for people who want to try to accomplish their care in that manner. That capacity is there. We have increased the number of face-to-face appointments. It is not to the 100% that it was prior to COVID, but right now what we have is we're going about 56% booked. So there's plenty of capacity for people who want to make an appointment to call and make an appointment. And then finally, we've increased that elective surgery. So a lot of cases were canceled during that time period where we were not doing elective surgery. And we've reached out to those patients, and we're in a very systematic way bringing them back and getting those cases in, as well as seeing new patients who have consults for certain specialty care. So a lot going on in the hospital, and what I don't want is for patients to defer care because of fear. Because I'd hate for their whatever clinical condition they have to go untreated. That's more dangerous than coming into the hospital. So please, if you have concerns, certainly give us a call, talk to your provider about what those concerns are, and we can mitigate a lot of those, but please seek the care when needed. There were a couple of questions that were put out there that if it's a good time,
Absolutely.
I'll go ahead and answer.
Yep.
One, somebody wrote, why were we notified by email from housing that someone who was in our home tested positive? There were no calls or no contact from the health department or the hospital on post. How many contact tracers do you have? This is concerning since we are a high-risk family. I don't have that letter, but I've asked for housing to provide that letter to me. So what I will tell you is if you're ever contacted by someone, whether it's by email or some other means, in this case we'll just say the housing contact, you are welcome to present to the hospital to have the team talk with you about that level of exposure, okay? I don't know who the employee was because I don't have that letter, but a lot of people are getting tested outside of Fort Belvoir Community Hospital. I'm not even sure if that worker was a beneficiary of Fort Belvoir Community Hospital. And so a lot of that tracing won't come from the installation. And I recognize that you weren't contacted by the public health department, but if you were to bring that letter in or come to the COVID clinic or that drive up, the team would then assess your level of exposure, talk to you about how much time you spent alongside of that person while they were in your home, and make a determination with you about whether or not they should test. We are testing most people who come to the drive-thru at this point in time, and so I don't want somebody to be concerned. If you get some sort of a notification, whether it's from a public health department or some other place, and you have questions about that exposure or that notification, please just come on in or give the hospital a call, and we will work that out with you and make sure that we get you the care that you need. The other question was, is it harmful for people with certain health conditions to wear a mask? And the CDC really, recommends that people who are actually physically having trouble breathing not wear a mask, right? And so there are things that they can do, whether it's social distancing, really limiting their activities outside the home during this time period, and other things that they can do to mitigate some of that. But all others, it's safe for them to wear a mask, okay? Even people who have COPD and other health conditions, unless they're having trouble breathing, it's safe for them to wear a mask. Those are the questions I have for this evening.
Before you jump in, if I could just say one comment. So before coming to town hall today, I was actually over at the hospital for a routine appointment with one of my family members. And I will tell you, I'll just echo Cindy's comment about feeling safe over there. From the time you park the car out front, go through the screening, all the way through the appointment with the providers and everything else, you can just see the professionalism and the diligence that the team has taken over there to make sure that everyone is getting exceptional care and is safe throughout the process. But that's probably the second time in 2 or 3 weeks I've been over at the hospital, and both times just felt, again, first-rate medical care, but also great protection for the pandemic, and I appreciate that. Thank you. Yeah.
All right, thanks, Cindy. Also, I just want to comment on the face coverings if you have medical conditions. So, fortunately for us, both the Commissary and Post Exchange both have programs. So if you are in that category, we have, one click at the Commissary where you can do your shopping online. It's sitting at the back of the Commissary for you. And then for the Post Exchange, they'll actually deliver a link up with you with your goods. So those are two good news stories for both the Post Exchange and the Commissary. So before we go into questions and answers, I just want to take a minute as well just to update the audience on some key topics and some takeaways. And so first, last week we talked about the Expedited Visitors Pass. We're 7 days into this. We have had about 73 people that have used this. This is really a good program for us, because if you didn't know, about anywhere from 300 to 400 people pass through our visitor center each day. Very, very small area. And so we have and I always try to spotlight something in the Eagle. So if you go to page 3 in the Eagle this week, you'll see a whole article dedicated to that process. Again, it's a good process. If there's feedback and it doesn't work or there's issues, please let us know. But I think we're pretty proud of that program, and it's a good way forward. And it just shows you there's some new norms that are coming down. We're using technology, and so this is one where you can register 72 hours out and then go through and pick up your pass. So that's a good news story. Second, I want to congratulate all the graduates at all levels. So we've been doing this over the last couple of weeks, and I also wanted to address one of the questions that came up about like a drive-in graduation or a parade. And I know there's been a couple of postings out there, and we have worked with the Assistant Superintendent of Schools and Fairfax County leadership. And at this point, again, we want to make sure that we are not causing teachers and children to come out in an environment when they don't really need to. And so at this point, we are not going to do a parade. We're not going to do any type of graduation ceremony. However, I will tell you there is some special recognitions going on. So typically we do a bridge ceremony for a 6th grade class. And so the elementary school is working hard, not on a ceremony per se, but I believe it's if the elementary could put that date on Facebook. I think it's the 4th or 5th. It's at Friday. They're doing in the afternoon, kind of just a pick up your books, pick up your certificate. Some of the teachers will be out there who's helping out from 6th grade. They'll wave to the children as well. I will probably stop out there as well and just wave from afar. And just again, congratulations to all our graduates from elementary school, middle school, high school, and college. I know that's a large event for you, and I know this time is pretty trying for your family. I also want to talk a little bit about child development centers. And so last week I talked a little bit more in details on what we're doing here at the installation. Over the last 4 or 5 weeks, we've talked about the limited capacities that are really going to be caused by our social distancing and some of the limitations in the classrooms. And so this morning, our Child Youth Services have sent out those mission essential letters for re-verification. I ask all parents of all the child development centers to go refill those out, bring those to your commands, and let them recertify your mission essential list. At the same time, we're also looking at the lower end of the list and trying to begin to notify those families that are, unless they become mission essential, will not have the ability to use our services at this point. Again, as we've talked about before, our capacity on our child development centers will probably reduce down into at least half capacity. And then remember, as we start opening back up, it's going to be slow opening. We want to make sure that we're protecting our child youth service and workforce. We also want to make sure that we're protecting our children. And so again, as we move forward, we will open them slowly, making sure that we abide by all guidance out there. And again, I know it's important to make sure we're transparent for one, but also expectation management. As I've said over the last 3 or 4 weeks, if you're looking for a child development center care now, or you're going back to work in a week or 2 weeks from now, my recommendation to you is, one, to reach out to our workforce, but more importantly, to find alternate care if our answer is that we don't have a spot for you at this point. I'll address a couple other questions on CYS a little later as we go in questions and answers. And then I wanted to update you on some of the Virginia Phase 1 guidelines that came out. And so Northern Virginia is joining, as Captain Judy said, is joining the rest of Virginia here tomorrow on Friday. And they're beginning with Phase 1. And so what does that mean? Well, one, if PAO can post the link on our Facebook page so you can also see it for yourself, the implementation plan. But moving forward, basically the governor has said that he's requiring face coverings in all public buildings. So again, here on the installation, we've been very clear that in those areas you can't maintain 6 feet in those designated areas, that we have been using face coverings. I appreciate your support on that one. But again, that will be a Virginia guidelines as well. Religious services can open, but must be limited at 50% at the lowest occupancy load, strict physical distancing, and frequent cleaning practices. Under restaurants, can offer takeout and delivery options and outdoor seating at 50% or at 10 or fewer. We've been doing here our takeout services. We are looking at those outdoor areas, specifically on 12th Street. If you haven't noticed, some of those tables have lost some chairs. Those chairs are being removed, and we're adding tables and distancing out, so we can also do the same thing on our outdoor facilities. Retailers can open, but must limit to 50% of its lowest occupancy load, strict physical distancing, and frequent cleaning procedures. Fitness centers, again, this is Virginia's phase 1. Fitness centers can open with outdoor operations, strict physical distancing, and frequent cleaning practices. Barber shops, salons, grooming services can open by appointment only with strict physical distancing and frequent cleaning practices. And private campgrounds can open under restrictions. I say that because that's what the phase 1 approach is. But as we've alluded to multiple weeks, that we're not on the same timeline as the county and the state are. We use those as conditions to make risk-informed decisions on the installation. But just because fitness centers are opening, that does not mean that fitness centers here on the installation are opening. We continue each week. We just had our recovery board meeting. We do those weekly with the directors and activity owners. We look at those activities that we can mitigate to a low risk. We look at conditions on the ground. We look at what mitigating strategies are there. We make sure we have enough PPE, or personal protective equipment, on ground. And then we inform General Jones as well on activities. And then when we feel comfortable and we know that we can provide a safe environment for our patrons and our community, then and only then will we open it up. And again, we have been transparent with a lot of our activities, and so we'll continue to do that as we go forward. Okay, those are all the updates I had at this point. I have questions and answers that I will do as well, but I'm going to turn it back over to General Jones. There was a couple questions for him, so I will start off with him answering some of those questions.
Okay. So 3 questions that we received before the town hall. First one is if I can explain the circumstances that would lead me to change the health protection conditions. And it's important to note that just in the past week to 10 days, Secretary Esper delegated to the services, and the services, at least for the Army, in turn delegated to senior commanders to make those decisions on health protection and condition levels. And so the first question is, what does that mean to you, and why does that matter? Because our health protection levels will really drive all of the things that Colonel Greenberg just talked about in terms of installation services and which ones can reopen, which ones can expand services, those kind of things. And that's really why that matters. What I would offer to you, and I think Colonel Greenberg really said it well, that we will be informed by what the local authorities are doing, and we're very closely tied to the 6 counties in the National Capital Region, as well as the District of Columbia, and watching what they're doing, as well as Virginia, and then for our installations up in Maryland, across the state of Maryland as well. But our civilian leaders have a different set of priorities. We share all the same #1 priority, and that is our people, to protect our people from the virus. And it's the same thing that our governors, our county executives, our city managers, our mayors, etc. #1 priority is our people. But our civilian leaders also have a responsibility to provide economic conditions and the conditions for businesses to thrive and economic growth. Our second priority is mission assurance. We have a responsibility that when the nation calls, we have to be ready. And when you look at those 2, conditions for economic growth and continued economic development and business climate and all the rest of that, and mission assurance, they kind of drive you 2 separate paces in terms of 2 different sets of priorities. What I will look at as I make decisions about the health protection levels, really 3 factors. One is what our civilian authority, what our civilian local jurisdictions doing. here for Fort Belvoir, what is Fairfax County doing? But also looking at the other counties where our employees and our workforce lives in and around the area that commute here to Fort Belvoir. And what decisions have they made, and what does their reopening plan look like? The second one is higher headquarters. For me, I have to look at both U.S. Northern Command and Department of the Army, and what guidance have we received from those leaders. And in many cases, that does come back to those priorities. Protect our people, but make sure we're ready. Make sure we maintain that mission assurance. And the third piece is we look at the environment. And it's many of the things that Captain Judy talked about already. We look very hard across the capital region, again, the states and the district, but also very closely at the 6 counties of the District of Columbia. We look at the number of new cases. We look at the case rate, it's the number of positive cases versus the number of testing. We look at the transmission of cases. One infected person, how many people are they infecting on average across the counties? Do our hospitals, both our military hospitals and our civilian hospitals, do they have the personal protective equipment? Do they have the capacity to take care of folks who are sick? And then do we have the testing capacity that are out there? And then I look to commanders like Michael Greenberg and I ask for their recommendations. So when I pull all that together is when I will make decisions to transition from HPCon Charlie to Bravo at some point down the road, and potentially, hopefully, to Alpha as well. But we also need to be aware, if we look back through history, these viruses don't move linearly. They don't just move 1 week after another, 1 month after another. There are ups and downs. And we may take a couple steps forward and a step back again. But at the end of the day, we're going to make sure that we take care of our people, and that from the military perspective, we maintain mission assurance so we can do all the things that our nation expects us to do here from Fort Belvoir and across the National Capital Region. Second question is that what, from my perspective as a senior commander, for Meade, Belvoir, Meyer, Henderson Hall, AP Hill down in Caroline County, what does the new normal look like for the folks that live on our installations? And I will tell you that, as I said in my opening comments, that the new normal is going to be with COVID-19 as part of our environment for a while. And I don't know how long that's going to be, but for a while, COVID-19 is going to be part of our environment until it is no longer a threat to us, to our communities, and to our people. So I do think that some of the things that are going to be part of the new normal, social distancing is going to be part of the new normal for a while. Frequent hand washing, face coverings when you can't maintain that 6 feet of social distancing. Many of our services are going to be reduced capacity so that we can set conditions for folks to have social distancing and maintain the 6 foot separation. And lots of cleaning, making sure that we're cleaning our environment as we're coming and going. And then I think it'll be a while before we have large group gatherings. And I think for a while that'll be part of our environment for the foreseeable future. As we change HPCon levels, we'll open more and more services. But even once we get to the point where we open probably as many services as we can in a COVID-19 environment, that's going to be the new normal for a while. And we'll have to consider all those factors I just described. Now the last piece, the last question that was sent to me ahead of time was, what do I think the new normal looks like for federal employees, particularly when it comes to telework and all the things that we have seen over the past really 70 to 80 days or so. And I can't talk to the entire federal workforce. Clearly, OPM, the Department of Defense, the military services, our combatant commanders will have a significant say in all of that. But I at least can talk to the Military District of Washington headquarters that's up at Fort McNair, that is also the Joint Task Force headquarters for this region. And what I would tell you is that what I have seen the team do in the past 70 to 80 days while working remotely, while teleworking, with less than 20% of our workforce reporting to the headquarters, has been phenomenal. People are still contributing significantly. People are still working hard, and they are making an impact that we have seen across the region every single day. At some point, we will have a return to headquarters, and we'll come together again, and we'll see more of our folks under the same roof again. And in all candor, I'm really looking forward to that. But will we telework more then than we did in the past? I think we probably will. Will we have more distance between desks, more distance between workspaces? Will we use video teleconferences more than in-person meetings? I think all that's true, and we're working our way very deliberately through that. And I'll talk a little bit in my closing comments about personal considerations, but what I've told our team, that's a big piece of it. This virus, this pandemic has affected each and every one of us, each and one of our families very uniquely, and we as leaders have to be thoughtful about that as folks come back to the headquarters, as folks come back physically to work and continue the great work that they've been doing virtually. We've got to be thoughtful about how this virus has impacted them individually, and it's going to be a lot of conversations between our teammates and leaders and directors across the board, so we do this right. And again, we take care of our people, but we also continue our mission. Thank you.
Thank you, sir. So I'm gonna open up and have talk about a couple more questions, and then we'll open it up for anything else out on the line. So the first one, there was questions about gate openings, additional gate openings. So again, this is a condition-based decision. I will tell you we're closer to opening up J.J. Kingman than we're not. And so I would predict here in the next couple weeks that J.J. Kingman will be the next gate that is opening up. What we're looking at is traffic patterns or traffic counts. So traffic counts have significantly increased over the last couple weeks. We're looking at wait times at the gates. So wait times at the gates, what we found is the surge period, traffic surge, is really not 6 to 9 anymore. Traffic surge is really most of the day. So although we have a lot more vehicles coming on the installation, we don't see tremendous backups at the gate. Right now, the longest backups are about 10 minutes long. And then we look at health of the force. Our security guards are doing very well. They're staying healthy. We don't have an outbreak. And so, those are really the three conditions that we're looking at before we open the gate. And so I'm not going to give you a date time group right now, but I will tell you that it will be probably in the next couple weeks when we open up that gate. There was a question about communications with our community leaders, and the questioning of sharing information or not being as transparent. And I would tell you, we share information with the county. The hospital shares information with the county. We get information really from the Virginia Department of Health. I will tell you, I have touch points with Supervisor Stork, Herity, and Lusk, which is the three local supervisors or mayors in this area. I touch points with them once a month. The county executive, Brian Hill, who will be here as our guest, one of our guests on 11 June. We talk weekly. And then we have dialogues with the state as well, with the governor's office, with Secretary Hopkins. And when we dialogue, we don't necessarily talk about case counts, but what's more important for us is we communicate and discuss opening plans. What's working for the county, what's working for the installation. Where are we going, where are they going? What challenges do they have, what's working well? Even going out and looking at some of their activities, them coming in and look at some of our activities. But we are transparent with our local officials. We are discussing a lot of our opening plans, and I think it's been working very well for us. The next question talked about our monitoring birds program here on Fort Belvoir. And so there's about 8 teams of volunteers that go out and they really do great work monitoring our birds, and they're waiting to go back and monitor those nested boxes. And so, again, I'm not going to give you a date, but I will tell you here probably in the next week or so, we will look at reopening that program and allowing folks to begin to monitor our birds. But again, as Captain Judy said, and General Jones, we need to be mindful of what the conditions are when we open. So in that activity, there's not a lot of risk to that. You're outdoors, it's a small group of people. But I will tell you, if the small group of people decide not to follow the rules and they start to group, and I have to start getting DES and our MPs involved, then a simple low-risk activity may be reclosed and then delayed again for another couple of weeks. So I ask, as we start opening activities and items on the installation, we're doing well. We're not doing perfect, but we're doing well. I ask you to continue to abide by the 6 feet and the face coverings. In that light as well, multiple times, there's not a question today, but it has come up before, and we've had a couple incidents about, hey, if we see a block party or we see activities on the installation that's not going as planned, what do we do? I appreciate the comments. I appreciate the feedback. What I would ask is, please, if you see something, say something. We all, as a community, need to protect each other. If that does not work, or you don't feel comfortable, or something is not making you feel comfortable, please contact our office, and we will send out patrols. We'll send out leadership. We'll do what we need to do to make sure that we're protecting our community. So again, please adhere to that. There was several questions on housing for this week. And I'll talk about one of the questions, but I'll also tell you that we do have a housing focus group tomorrow that's coming up that will talk about most of these questions at hand. But I do want to address, there was a question that came up. There's a question that came up about reasonable expectations for safety concerns, and the one that was brought up, there was some unlocked electrical boxes across the installation at large, and it was discovered probably about 30 days ago. They let us know, Garrison know, about 21 days ago, and maybe because we weren't as transparent, they thought that there was nothing being done. And so I do want to report back on that one because it does affect a whole lot of people on the installation. So there's about 5,000 of these electrical boxes. The villages of Belvoir have done a complete screening, they believe, of all areas on the installation. They have found those that were identified, but some others as well. They have worked with DE or Dominion Electric because, again, those locks are universal locks. And so it can't just be throw a lock on there. Those have been done. Those boxes have been locked. What I would ask you is if what I've been told, if it's not true, or there was an oversight and there's electrical boxes on the installation that you see, please go back out, reach out to our Department of Public Works, our housing office. Let us know where those boxes are, and then we will re-engage with the villages. The rest of those questions about housing, I will discuss tomorrow at the Housing Focus Group, and then we'll readdress some of those at future town halls.
And Michael, if I may.
Yes, sir.
And I appreciate the Housing Focus Group tomorrow. What I would tell all the folks that are out there, and particularly the folks that have attended the housing town halls in the past, one, I miss seeing you. I miss having the conversation about housing across this great installation. Please know that despite this current environment, despite the pandemic and the focus on it, there is absolutely no change in the priority that the Department of Defense, the Department of the Army, this headquarters, and I have on making sure you have housing that is safe, it is secure, it is the right quality, and it is healthy. And there's been no change in that commitment and no change in that focus, and we're not going to let up the continued effort to make sure that we are able to do that for every single individual that lives here on Fort Belvoir. So please keep engaging the housing office here. Please keep engaging our housing partner, and we will make sure we continue to provide you the house you and your family deserve.
Thank you, sir. And we have hired an ombudsman, and so that ombudsman should be coming on board here in the next 4 weeks. We have also now have one, and our second industrial hygienist should be on board. Thank you to the hospital for allowing us to use the hospital's industrial hygienist. So we're slow due to the COVID environment. I want to just clarify a couple comments from last week. So I talked about emergency work orders being done. If those are not being done, please let us know, because as far as we know, those are being done. There was a comment about a tree that was dead that someone thought would fall. Please let us know that. I am not tracking, at least at my level, any trees that are a safety hazard that would fall. For our urgent work orders, those are being done as well. Again, case by case, most of those are being done. What someone posted was that I said all outdoor routine work orders were being done. If I had said that is not true. Okay, the intent was those outdoor work orders that can be done, some of them are being done, but not all of them across the board. There was a comment about power washing. Individual power washing is not being done. They're doing them in groupings, the villages of Belvoir. But again, some of those questions will be answered tomorrow. There was a question on, as Phase 1 is beginning in Northern Virginia, includes beaches and parks openings. Can you communicate the plans to open outdoor activities such as basketball courts and playgrounds? Again, as I mentioned up front, there will be a lag time between what the county is doing and the state's doing and us. I understand basketball courts and playgrounds are of concerns, not necessarily concerns, but people are anxious to open those back up. I will tell you right now, playgrounds will not open probably for the next couple weeks, if not a month or so. Again, no timelines out there, But again, until we establish some standards and make sure that we can meet the standards here on the installation, we want to be very careful on opening those. We are looking at basketball courts. We are looking at some of the outdoor activities. We are looking at the marina. The basin is open. I think someone talked about the gardens. I think maybe they were talking about the basin and not the gardens. If there's a gardens out there, please get with my staff and let me know what that means. I think that may be a housing area, but the basin is out there and open for use. Again, social distancing has to be adhered to, and face coverings when you can't keep those distances. There was a question for RSO. Again, the question was, can the chapels be used for private prayers? Again, reach out, and I appreciate all the people out on the line that are answering behind the scenes between the hospital and all the Garrison staff and others out there. What we don't see each week is all those folks that are answering all those questions out there as people have them, so I know that's been very useful. So if there's questions for the RSO, please send them out there. But for private prayers, those are allowable. There have been some out there, so if you have a question or you have a special request, please reach out to the Religious Support Office and they'll be able to help you out. As far as some of the Catholic community requirements out there, we are working with Archbishop of the Defense Department for some of those guidelines out there, so more to follow. I'll let the RSO answer some specific questions on there. I want to provide information on some inaccurate information. Okay, and so someone put out there that the RSO is only providing services and resources to the Protestant congregation. And again, that is not true. So again, I ask that as we post information, please, and that may be a perception out there, so it may not be an intended consequence, but I want to make sure we're clear. We are doing services for more than the Protestant services. We are providing additional items for other religious areas. And again, if there are folks out there that are having challenges or think we are not accommodating them, please reach out to the Religious Support Office and let us know. Please keep in mind that we only have our staff of who we have for those sects of religion, and so that may be a question. But again, we have lay leaders and others out there that really help with all religions across the installation. A couple more, and then do we have some questions out there, Eliza?
Yes, sir. How long will the screening at the PX and Commissary, as well as the courtesy patrol, last?
Okay, and that's a great question. And again, it's going to be condition dependent. Right now, our PX operations are lowering a little bit. We are not doing temperature screening anymore at the PX. We are only doing it at the Commissary. We are doing COVID patrols as well across the installation, really to help set the norms for the installation. And they are doing a good job. We are trying to take neutral sides, so without being aggressive in nature, really just trying to inform people, to remind them to wear their face coverings properly over their nose and their mouth, and just make sure they're wearing them. As far as time frames are concerned, General Jones did extend out the public health emergency for an additional 90 days, and then he has the abilities to remove that. And so as we go into those next phases, and we go down to an HPCon Bravo or Alpha level, those will be some things that we consider. But right now, the Commissary, as far as I know, will stay enhanced screening, at least for the next week. If something changes over the next week, I'll let you know next town hall. COVID patrols will be at least the next week. If something changes, I'll let you know on that as well. And so you have any comments on that?
Nope, you covered it well.
Okay, great.
What is the plan for outdoor pools?
And that's a great question. So the county, the question was, what's the plan for the outdoor pools? So if you haven't noticed, we have started our operations of getting pools ready. We were going to do that anyway because we need to make sure we're working on the pumps. We have lifeguards that are flex employees that can surge up if we do open the pools. Fairfax County talked to the county executive Hill yesterday about pools. Right now, the county's plan is they're not opening pools. That doesn't mean that we're not going to open pools, but that doesn't mean we are going to open pools. We do have a training requirement out there as well. And so for those, again, as General Jones has alluded to and I've said in the past, for mission assurance, we will open things to make sure that we are trained and we can provide the mission that we need to provide. And so for those units that have mission requirements in the pool, that pool will be open for their mission requirements. We will assess the situation and make sure that we can reduce the risk down. Part of the challenge is CDC hasn't posted really any guidelines for what a pool would look like. And so we have to wait for guidance on that as well. So I'm not telling you the pool is closed for the entire summer, nor am I telling you that the pool will open this summer. I'm telling you that with conditions-based, we will continue to look at that.
What is the COVID clinic number?
Can you hear me now? Okay. Yeah, the clinic number is 571-231-0532. Again, that's located in the back of the emergency department, and there's a drive-up service there as well. So again, the number is 571-231-0532.
Last week, we were told that the Education Center would open when the threat level goes down. Which level will it be at, B or A, and when will this happen? Does the garrison commander make the decision about the levels?
So I'm going to answer the last question first, and as I'm answering that, I'm going to have the Director of Human Resources come up and help answer the question on the Ed Center. So as far as the levels, so right now the HPCon or health protection condition levels are at the sole discretion of the senior commander. As they alluded to up front, the SecDef had the authorities. We're waiting for it to officially come down to the senior commander. But here in the future, we expect the senior commander will make that decision. There has been questions in the past whether it's a coordinated effort between garrison commanders and just across Virginia, Maryland, and DC. The answer to that is yes. General Jones is the Joint Task Force Commander, Joint Force Commander, gets updates from all three. Likewise for activities, as we start opening activities at the garrison level, myself and my peers, not just at Meade and Meyer, but also at Quantico and AP Hill also talk about those services. As far as the Education Center, I'll let Mr. Rennick answer that question.
Thank you, sir. Can you hear me? Can you hear me? Good afternoon, all. Kevin Rennick, Director of Human Resources. I hope everyone can hear me okay. So to answer the question pertaining to the Barton Education Center in Oakland, so I kind of just want to caveat what the garrison commander stated, that of course we're looking at all our services across the installation and enterprise at whole. We want to ensure that whenever our doors open, we have taken every precautionary measure to ensure the safety of not just our workers, but those patrons and customers in whom we serve. So we do understand the anxiety of trying to get back to normal, but right now we have to follow the conditions. We do have specific guidelines at the highest level. So once we have meet those measures, we will certainly open our doors and provide those services back to our community. Thank you for your patience and understanding.
Well done.
All right, great. Hey, can we if we can't get that, just cut it off. We'll use a command voice. Go ahead and lower. So sorry for the audio issues. Hopefully you can hear me okay, but we're just going to talk a little bit louder for the last couple of minutes. Any other questions out there?
Yes, sir.
Okay, I'm just going to answer just a couple others that we didn't get to. So the first one, the CDC doesn't recommend masks for under 2. To clarify, what's the base policy? Okay, so there's two different. So children, and so the state's standard is anyone 10 and over must wear a face covering. On the installation, we left it general at children. In the CDC's specifically, our policy is 3 and over. Okay, so, and we have been enforcing that. We will continue to enforce that. We continue to engage our higher headquarters to see if anything has changed. We have just done that again because some guidance has, additional guidance has come down. But as of right now, in the CDCs, it's children at 3 and over. Across the installation, it's 3 and over as well. Just be smart on what we're doing with face coverings. Okay, another question, is the Marina open? I have a PCS, I PCS with my boat, and I want to know if I can drop it off and make it available. And so the answer is, the marina is not open right now. This is one of those that we were looking at very closely. In fact, we went through the recovery board today, looking at all those mitigation strategies out there to make sure that we have a good plan to open the marina. Understanding marina, the Maryland waterways are open. I understand, no rentals. So our marina does not do rentals. The rentals, our boat rentals, are really done by Outdoor Rec. So when our marina opens, we won't have rentals up front, but we will open it again. Not to give you a timeline, but those are one of our activities that we will open up here probably in the next couple weeks. Barber shops. So question came up on barber shops. I talked a lot last week about barber shops. And so right now the plan is, and I'm going to give you a date, so mark it down, but it's a soft opening. And what I mean is we're going to decide tomorrow at 1500. But we're going to go ahead on barber shops and plan on opening the barber shop at the Post Exchange on Saturday. We talked about all the mitigating strategies. Those are still in effect. Okay, so by appointment only, service members in uniform only, female service members can also go. We do have a hairdresser Monday, Wednesday, Fridays that will be at the 12th Street Barber Shop. And again, it'll be appointment only, face coverings for both parties, and then I outlined several other measures. So if I can ask my public affairs to put out those numbers on the screen. And so for the Post Exchange Barbershop, again, it'll be open on Saturday morning. The appointment line will open at 1500 tomorrow. That'll be after a decision is made. If a decision is made that we need to delay, we will post something on Facebook and on our social media letting you know that we're delaying the process. Okay, for 12th Street and the hospital barbershops, those will open on Monday. Okay, we're going to post those appointment lines as well. There'll be a 4-hour timeline on Sunday to be able to make appointments for Monday and beyond. If I can get AVs, I can't remember off the top of my head, I have too many papers here. So if you can just post the hours of when the appointment line will be open for the barber shop and for 12th Street to make appointments. I believe it's 12 to 4, but please verify that for me. Again, so that will be one of our first activities open. Again, the waiting will be outside the barber shops. And again, we will be monitoring those very closely. If, like in everywhere else, the COVID patrols will be out trying to enforce the standards. Not trying, but will enforce the standards. I ask if you get an appointment, again, you need to be in uniform starting out. As we go along, again, it could be weeks, it could be a month. I can't give you a timeline. We will start expanding that out to non-service members in uniform, and then start extending out other services that are provided here in the future. But again, this is a start point for barbershops. Okay, any other questions out there that came up? Okay, I'm gonna leave it up. Cindy, any closing remarks?
Sir, sure. I just want to thank everyone for their ongoing questions. I really appreciate the thought that's put into the questions and the social media etiquette that we see on these town hall events. The community's doing a really great job. I just want to tell you, your questions not only help us inform the community, but they also often provide us an opportunity to really reassess what we're doing at each of the different locations throughout the installation. And so by bringing those things up, it gives us an opportunity to really improve the services that are being offered throughout the community. So thank you for that. Once again, please come to the hospital or make an appointment if you have a health concern. It is a safe place to come to, and we want you to get the care that you need.
Thank you, Cindy. I'll make some closing remarks, and I'll turn it over to Joan Jones to make the final remarks. So again, like I've done every time, thank you. Thank you for the community for being patient with us and to adhering to the standards and the guidelines that we put out. Thank you to the workers out there. It takes a lot of people to run the installation, not just those coming on physically, but those that are working from home to make sure that we're providing the services that we're providing to each of our folks. For the first responders out there, the police, the fire, the hospital, our CDC workers, and all those that are coming in really to provide those services, thank you as well. I know, you were risking your lives as well and your health to be able to do that. And then all the contractors out there that are providing all the maintenance and everything else out there. So again, very much appreciated. We can't tell you enough how much we thank all your efforts out there. Second, thank you for participating in this virtual town hall. As Cindy has said, these are very useful, not just for you, but for us. Not only can we give you the information and be transparent and give you up-to-date information, we also you provide us the feedback. You challenge us and ask us questions that maybe we haven't thought about. Hopefully you have seen that some of those questions have come to reality. We've implemented a lot of those ideas out there. And again, we don't know everything, and so that feedback is really important to us, and it makes us a better community as a whole. And again, just a reminder, this will be out there, posted on Facebook. If you missed anything, you want to rehear it, it will be out there again. Please continue to stay safe, stay vigilant, and continue to practice social distancing, wear your face coverings, and wash your hands. And also remember, we need to work together. We together can make a difference. However, as General Jones said, the virus is still out there. These preventive measures that we are putting in place is keeping our community safe and healthy. And so with that, I'll turn over the final comments to General Jones.
Thank you. But Michael and Cindy, thank you, and I appreciate you letting me join you today. And to the whole team that's out there, thank you for watching the town hall tonight. Thank you for your engagement, and thank you for what you are doing to continue making such a great community. So we're going to just wrap up with four points. First, as Michael just said, and I've said a few times throughout tonight, the virus is still out there. So as we look at services, ed centers, pools, barber shops, etc., what we're looking at is how can we bring that service back to the community while still protecting our people. We still have to do the social distancing. We have to do the face coverings, all of those things to make sure the cleanings in between, etc., so that it's not that the virus went away, and it's not that reopening forces the virus away. It's how can we bring services back in a way that is safe and takes care of our people, because the virus is still out there. Second point, and I know everyone that works here and lives here in Fort Belvoir knows this, but I know the town hall attracts a lot of folks from both off the installation and in some cases the broader community. What I will tell you is that absolutely rest assured your military across the services and across the world remains ready today to do whatever the nation needs it to do. We operate on the seas, we operate in the air, we operate in the desert, we operate in the Arctic. Part of our job is to be ready and do what the nation asks us to do in a variety of environments. A pandemic is a very different environment, but we're still ready. So when the nation needs our military, your military will be there, and I promise you your military is ready to go today for whatever our country needs. The next piece, I talked a little bit a couple times about personal considerations. And I would just ask, as you're talking to coworkers, whether it's on the telephone, video conference, Teams, or whatever system you happen to use, or whether it's 6 feet away, or neighbors, whatever it happens to be, this pandemic affects each and every one of us individually. And we all need to be aware of that and thoughtful about that going forward. And I'll just tell you, for the Jones family, my wife is an elementary school counselor up in Maryland, so she spends her days talking to 5th graders to kindergartners by video conference, talking to the parents who, like many of you, are dealing with distance learning and all the challenges that go along with that. I've got a son who's a first lieutenant who's deployed right now and is sequestered with his platoon in Eastern Europe, waiting to redeploy later this summer. I've got a middle son who is a college senior that spent the second half of his last semester in college at my dining room table, finishing his last projects and taking his final exams. And I've got a son who is a high school junior who just took all his AP tests from his bedroom on his home computer and is trying to figure out what a senior year in high school is going to look like. My family is by absolutely no means unique in that, and we've been incredibly fortunate that have not been directly impacted from the illness from a health perspective by the virus, but each and every one of us has personal circumstances because of this pandemic. Share those. Talk with your teammates, talk with your neighbors about how it's affected you, and for everyone else, be empathetic to that and listen to that and have those conversations. That's going to be part of who we are going forward in terms of how this pandemic affected each and every one of us. And the last comment, all the discussion about social distancing and staying 6 feet away and making sure that we protect ourselves. Please do not ever mistake social distancing from social isolation. back to personal circumstances, personal conditions. We need connectedness now more than ever. So please reach out. Reach out to old friends that you have. Reach out to the neighbors. Reach out across the fence. Figuratively, not literally. You know, pick up the phone and call. You know, whatever it happens to be, but get that connectedness. We need that as a community, and I think the community is doing a tremendous job of that, and please keep it up. I'm incredibly proud of what Team Belvoir has done. I'm excited about where we are going in the future as we move forward. Please continue to take care of yourselves, take care of your families, and take care of those around you. Thank you for participating in the town hall today.